to and for you Healthcare News Network, where patient advocacy begins with patient education. When you sit in a doctor's exam room, you're usually focused on the obvious things: the stethoscope, the blood pressure cuff, trusting that your provider will help you manage your health. Today, let's take a moment to understand how health information can actually predict the future of a patient's health. Health information data is the denominator of massive amounts of funding, but more importantly, it is the voice of generations that nurtures human frailty. There's a secret hidden language being written right in front of you the whole time. A highly specific matrix of diagnosis and procedures that form a clinical currency. A stream of highly regulated words and codes going straight into your medical chart. We are positioned to assume it's just a dry administrative billing process, paperwork. Just the doctor clicking boxes to get paid. Actually, every diagnosis and treatment builds a complex stratosphere of statistics that represents the entire healthcare payment system. Instead of a flat rate, federal healthcare payments are distributed to the health plans based on the actual documented risk profile of their specific members. The sicker the patient, the higher the payment. This statistical adjustment ensures that health plans and doctors have the resources they need to care for our most vulnerable populations. To explain how this statistical process actually works, look at the metric that every diagnosis and treatment produces: the risk score. The magic number for clinical currency, the RAF score, which stands for Risk Adjustment Factor. For example, imagine an RAF score of 1.0 for an average baseline, indicating that a patient is expected to use an average amount of healthcare resources. There are no negative RAF scores. A young, perfectly healthy person who only sees the doctor for an annual checkup will have a score well below 1.0. Functioning like a credit score for a patient's health status. There are several other payment metrics that have different scoring systems. Today's educational resource focuses on how the RAF system behaves. All systems have similar behaviors. They are a money metric built on the patient's health status, used as a predictor of payments to healthcare organizations for providing direct patient care. The algorithms always start with common demographics. They factor in your age and your sex. Whether you have dual eligibility with Medicaid, your disability status, or even your original reason for qualifying for Medicare in the first place. Those demographic factors establish the clinical currency foundation. A middle-aged female patient without chronic illness may start with a demographic baseline score of, say, 0.3. The RAF score is then added on top of that baseline demographic score. If the same 65-year-old lady is diagnosed with uncomplicated migraine headaches, the HCC model might assign an additional score of, say, 0.1 to her RAF. Her total RAF is now 0.4. This means the physician will receive an increase in payment. ICD-10-CM, International Classification of Diseases, 10th Revision, Clinical Modification. This classification system is essentially the universal diagnostic dictionary that providers use to statistically track patient care and request financial reimbursement. ICD-10 codes assigned require strict validation of physician documentation. Code assignments are carefully researched by a medical data scientist, also known as a medical coder. Defining a numeric picture to validate every patient's health severity hierarchy. The ICD-10 codes collaborate with electronic patient records to assign several care pathways autonomously, which means coding is clinical communication. If the ICD-10 code is missing by omission, or is not specific, or is incorrect, the systemic hierarchy will be inadequate. Accurate risk adjustment provides the financial resources to deliver true person-centered care. The entire system relies on the integrity and accuracy of data submission. When healthcare providers make reporting errors, the data becomes corrupted, the risk scores drop or inappropriately rise. The funding evaporates or is inappropriately distributed, and the patient's care pathway is severed. A healthcare provider cannot simply copy and paste a list of diagnoses from a visit 3 years ago, nor the day before. That is not the definition of patient assessment. Every new billable assessment requires the unique details of that real-time, face-to-face encounter. Federal regulations obligate providers to create unique, specific, accurate care notes. The National Preferred Documentation Approach is MEAT, Monitoring, Evaluation, Assessment, and Treatment, MEAT. These are the main cornerstones that support quality physician documentation. Most importantly, health information accuracy and data integrity are mandatory, literally a federal regulatory demand. This requirement was passed from generations of health information that was gifted to the present generation from the lessons learned from decades of practicing healthcare providers. Unfortunately, there is a dark side to the technology-driven clinical currency ecosystem. What happens when this data is manipulated on purpose? That crosses the line into outright fraud. Because the RAF score directly determines the volume of funding a healthcare organization receives from the government, there is an immense financial temptation to artificially inflate those scores. A pressure from higher powers to maximize reimbursement under manipulative narratives that seem harmless in the heat of the moment. Data manipulation driven by falsified medical documentation. It involves changing or adding severe diagnoses or procedural details to a patient's file to obtain higher reimbursement. A malicious actor can use data mining software to identify terminology that achieves higher reimbursement. This is the highest level of fraud. The manipulation of health information destroys the quality of patient care. This fraud not only steals money from the U.S. Healthcare Trust Fund, it also steals decades of trust. Falsified medical documentation is a crime against humanity. That destroys healthcare for present and future generations. Protect health information. We are the patient. Every individual healthcare worker has a voice. You are not obligated to be silent when your voice needs to be heard. Data accuracy and integrity are federal regulations that protect the commonwealth of humanity. Protect quality healthcare. Your health is your wealth.